Good afternoon. My presentation is about spina bifida. Spina bifida is a neuronal tube defect that occurs very early in pregnancy. The neuronal tube is embryonic tissue that develops into the brain, the spinal cord. The clinical manifestations are spina bifida occulta and spina bifida aperta. The first one occurs usually without symptoms and without signs. But the spina bifida aperta, there are two types, meningocele and myelomeningocele. Occurs with a particular sign. There is a sac that protrudes from the baby's back. It would look almost like next. This would be the meningocele, when the protrude sac only containing the cerebrospinal fluid, but the spinal cord remains in the vertebral canal. In the other one, myelomeningocele, the spinal cord and the nerves surrounding protrude through the open vertebrae into the sac. Next. The signs and symptoms, usually myelomeningocele is accompanied with several other complications as paralysis, closed eyes, incontinence of both bowel and bladder, musculoskeletal deformities, Shari number 2 malformation of the brain and hydrocephalus, late test, allergy, and mental retardation. Degree of severity, it depends on the lesson, where it is located, but most of the cases is located in the lumbar sacral region, level of L5 and S1. The cause associated with this disease is significant. According to the Spina Bifida Association, $532,000 would be the cost for each child during her life. These include care, surgical costs, and assistant devices. That in a year for the United States is approximately 200 million. The etiology is unknown, but hypotheses point of predisposition, genetic predisposition, teratogenic exposure, and folic acid deficiency. So the prevention points of continuous supplies of folic acid every day, because this vitamin doesn't get storage in our body. So everything that is not used is eliminated. Morbidity and mortality. Morbidity is higher, 1 or 2 of 1,000 children. The mortality rate is about 10% of the cases, usually in the operation that is performed during the first days of the baby life. Diagnosis through prenatal tests and sonograms. The treatment, there is no cure for this disease, but the treatment is focuses in treat the complications and includes surgery, medicine, physical, and psychological therapy. Surgical include the spinal surgery to repair the spine, place it into the vertebral canal, and the implantation of a shunt in the brain, trying to drain the excess of cerebrospinal fluid. Physical therapy starts very early in the life of these children. Varies according to the age and the paralysis degree and motor and paralysis degree. The finding a specialized physical therapist is not a challenge. You can go to the association of Spina Bifida and they will provide information about it. The main goal of physical therapists is help the child to obtain maximum mobility and stability in different positions. In babies, usually the physiotherapist help the mother or the caregivers to perform range of motion exercise and massage. And when they are growing up, developmental skills of sitting or standing, working out, preparing them for gait treatment. Next. Next. The prognosis is very optimistic, although it depends on the severity of the disease, but most of the children have happy life, mental skills normal, and most of them can ambulate independence with or without assistive devices. These are some of the assistive devices using in the process when they are babies, trying to help postural sitting, balance, in this case balance and coordination. Next. Preparing a little child for gait. Usually walking is delayed in these children, so some of them just go through the wheelchair. Thank you.